Good afternoon, everyone. Today's lecture is by Dr. Apurva Pedarkar, who will be speaking about postural reflexes. Dr. Apurva has completed her Bachelor's of Physiotherapy from KLE College of Physiotherapy. She has also done her certification in orthopedic manual therapy, dry needling, IASTM, and sports taping. Before we start this session, I request everyone to keep their mics on mute to avoid any disturbance and kindly save your questions till the end. Over to you, Dr. Apurva. Apurva, unmute yourself.
Yeah, hello.
Yeah, now you're audible.
Thank you, Dr. Jocelyn. Good afternoon, everyone. Today I'm going to present on postural reflexes. Disclaimer: this talk is intended for the educational purpose only. It reflects our opinion and are based on our best judgment, but no warranty is given or complied as to their accuracy. Define. So, postural reflexes are responsible for the subconscious maintenance of the body's posture when movement and position is altered, and they ensure that the body remains in upright and aligned. They provide automatic control of posture, balance, and coordination. So, when does it emerge? It, it should emerge gradually when the primitive reflexes fades and the postural reflex gets established, that is in the first year of life, and it should start by the second or the third month. So the postural reflexes are formed at the higher brain centers such as midbrain, vestibular nuclei, cerebellum, and cerebral cortex, which integrate sensory information from vision, proprioception, and vestibular inputs. This means they are mediated from the higher centers than the primitive reflexes, and so their appearance signifies a maturation of nervous system and the primitive reflexes. So what is the purpose? The primary purpose of the postural reflex is to maintain stable posture during voluntary activity or movements. From the moment an infant learns to first hold their head up to the time the child begins to walk upright, these postural reflexes are essentially supervising spinal structure, functional development in direct response to the constant force of gravity. So, it is the tool to assess the central nervous system's integrity in infants and young children. So, what will be the interpretation? Postural reflex texting either will be present or we can say absent, and depends upon the age. So how postural reflexes works? The postural system relies on a continuous reflex arc involving three main stages, that is the sensory input, the integration, and motor input. So what comes under sensory inputs? The body senses changes in orientation through three primary systems: vestibular, proprioception, and our vision. So vestibular system senses the position of the head body with reference to the gravity with structure in the inner ear. Movements may be linear, vertical, horizontal, or rotating. For example, labyrinthine writing reflex. We'll learn about it later. So next is proprioception. Proprioception will be receptors in the muscle, tendons, joint, which sense the body position relative to the surrounding surfaces. For example, toning stretch reflex. Now vision. Visual cues which help calibrate partial orientation and anticipate environmental changes. And it also work in collaboration with the vestibular system to ensure a stable visual field even during the movement using the vestibular ocular reflex. So For this, the optical writing reflex is an example. Now, integration. These sensory signals are processed by a brainstem, which includes medulla and midbrain, and the cerebellum. The cerebellum acts as a control center, comparing intended movement with actual body position and fine-tuning muscle tone. And last will be our motor output. The sensory nervous system transmits signals down the spinal cord via the pathways like vestibular spinal tract to rapidly adjust extensor and flexor muscles, which helps our body to keep in a stable position. Now we'll go to the types. So there are three major types: segmental, tonic and writing. In segmental, another four types are there, that is stretch reflex, crossed extensor reflex, positive supporting reflex and negative supporting reflex. And the center of origin of the segmental reflex would be spinal cord. Second is tonic. In tonic it will be tonic neck and tonic labyrinthine. And the center of origin is medulla. And the third is writing. In writing, there is neck writing, labyrinthine writing and body writing, which the center of origin will be midbrain. And for the limb writing and optical writing, the center of origin is cerebral cortex. So we'll see what is the stretch reflex. The center of origin is spinal cord. The stimuli here will be stretch. Receptor will be a muscle spindle, and the response would be muscle contraction. So I have an example for it. For example, sway forward while standing. So when your body sways slightly forward, the calf muscle are stretched, and the muscle spindle detects the stretch, causing this muscle to contract. This pulls the body back to an upright position and prevent you from falling. See, this is the example. When you try to step forward, the calf muscle is stretched, and which sends the signal, and it is contracted so that you stand in an upright position. So it is basically a stretch reflex. There is another example also, which is our normal reflexes like patellar tendon and all of those. So what is the clinical correlation? In condition like a stroke, the stretch reflexes become exaggerated and leading to increase in a muscle tone, which affects the posture, movement and balance. That's why the patient is not able to put the limb or step. Their muscle goes into a stretch reflex. Next is crossed extensor. The level is spinal cord. Stimuli is stretch, receptor is proprioception, response is flexion and extension of the limb. For example, when one leg is flexed, the opposite leg may extend excessively. So this is the example. Here the baby's one leg is flexed. At the same time, the another limb goes into extension. This is called as crossed extensor reflex. So, in spastic cerebral palsy, the opposite extensor reflex will be exaggerated and persist beyond the normal age because of the UMN involvement. When one leg is flexed, the opposite leg may extend excessively, causing abnormal posture, scissoring gait, and difficulty in standing. Third would be a positive supportive reaction. Level is spinal cord, contact is stimuli with the sole, proprioception is a receptor, and response is foot extended to support a body. So, when you press the pads of the toes, and then the dorsiflexion of the foot becomes. So, the positive supportive reflex is an early standing related response. When an infant is held upright and then feet touches the flat surface of the ground, they extend their legs and attempt to bear the weight. So this reflex is considered the first postural reflex supporting erect posture. See, this is the postural positive supporting reflex, where the both legs are extended. But what happens when, if the child is not able to achieve this reflex by the age of 1 year, the child falls into the developmental delay pathology and face difficulty in further development, that is standing with the support and later independent standing. The fourth is negative supportive reaction. It is level will be a spinal cord, stimuli again stretch, receptor will be the proprioceptor of extensor, response would be release of the positive supportive reaction. So here what happens when a pressure on the foot causes leg and trunk flexion. Before it was leg and the leg extension, but here it is flexion. Why it is flexion? Because see why it is important that positive supporting reaction has to convert into negative in order to stimulate walking pattern, that is stepping forward reaction. In stepping, child needs to flex one leg instead of extending them. So what happens is that when foot touches the ground, child tends to withdraw it, that is flexion, see here, flexion of the leg instead of extending them, which was there in the positive supporting reaction. So what happens in case of cerebral palsy, the negative supporting reaction abnormally persists due to a CNS damage. Now fifth is tonic neck reflex. Here the center of origin is medulla. Stimuli is head down to one side. Receptor is neck proprioceptor. Response would be change in the pattern of extensor contraction. So what is the example? When baby's head is tilted to the one side, either left or right. So we considered it to a left, then the extension of the limb on the same side and flexion on the opposite side. This is the positive reaction. So what happens is in tonic neck reflex, which helps in crawling, building tone in muscle or head and body eye coordination and head proprioception with the body. So what happens if it persists beyond the age, the positive pattern will cause the difficulty in grasping. So you need both the hands to go for grasping. But if this persists, it will cause a difficulty of further development like crawling or reaching for an object. In tonic neck reflex, we have more too. That is, another is when baby's head is turned up. Response is forelegs extension and the hind legs into flexion. And third is when baby's head turned down, the foreleg will be in flexion and the hind leg into the extension. Number 6. Tonic labyrinthine reflex. Lever is medulla, stimuli is gravity. Receptor is vestibular system, response is righting of the head. So here we have two examples, one in a flexion position and one in an extension. So what happens in flexion? As the head bends forward, see here, when the head bends forward, there is a flexion of the all four limbs. See, there is a whole body, arms and legs and torso curls inward in a characteristic fetal position. This position emerges at the 12 weeks in utero and should be integrated by 4 months after birth. And another is extension. As the head is bent backward, the whole body, arms, legs and torso straighten and extend. This position is present at the birth and it means fully integrate by approximately age of 3. So here is the example. Here when head is back, all goes into extension, and when flexes, all goes into flexion. So what happens if it does not integrate, or what if it persists for a longer period? So when the tonic neck reflexes, the forward pattern is retained, it can lead to a poor posture such as slouching or a low muscle tone, difficulty in bending their head forward to look at an object in their hands or a desk. Backward pattern might persist as hyperextension, rigid posture or tendency to walk on toes. Both patterns can contribute to a poor balance, motion sickness and challenges with the visual tracking. And so that's why it is a critical for this reflex to integrate because correct alignment of the head with the rest of body is necessary for our balance, visual tracking, auditory processing, and organized muscle tone. Seventh is neck writing reflex, which is also called as neck on body. Here what happens, the level is midbrain, stimuli is stretch of the neck, proprioception of the neck is receptor, and response will be writing of thorax, shoulder and pelvis. So the test would be when baby lie on a supine on his back, if the head is turned to one side, the whole body has to follow the same direction, that is also called as log roll, until it got to align with the head. So when neck is moved, the chest will move next, lumbar, and followed by a pelvis. So this neck writing reflex helps in crawling or sitting from a side. So what happens if this is absent? Absence of the neck writing reflex in child can lead to a difficulty in aligning the body's orientation with direction of the head, which is crucial for movement activities like rolling over. This can result in challenges with rolling from prone to supine and also vice versa, supine to prone. Also difficulty in sitting up, which is the next development, and then standing. So the reflex is absent in conditions such as cerebral palsy, where there is a strong flexor tone. In the children with hemiplegia, where it may be normal on the unaffected side, but it is a problem. And the severe cases of cerebral palsy in the writing reflexes are usually absent, preventing the child turning from a side over or turning from supine to prone position and further sitting up, that is. Now the next is body on body, that is body writing reflex. So level is midbrain, stimuli is turning first pelvis, there it was a neck. Here it is a pelvis, then receptor would be proprioception of the pelvis, response will be writing of lumbar followed by chest and neck. So example is when here the pelvis is tilted to a right or left, the lumbar, the chest and the neck has to follow the pelvis and the whole body turns over the body. So clinical correlation is it appears at about 7 months of the age and is response of the body to pressure stimuli. See, here is a example. Baby first in a supine position, we have to turn first the pelvis, flex and rotate with the leg, and it follows the trunk and then neck. Then eighth one is labyrinthine writing reflex. It is, you can also say head writing reflex. So level is midbrain, stimuli would be stretch of the body. Here the receptor is vestibular system, response is writing of the neck. So what happens is when a body is tilted to a right or left in a vertical suspension. So here head has to remain in a vertical position, causing neck pulls to an opposite side. So this should happen even if the baby is blindfolded. And the clinical correlation is the labyrinthine writing reflex are strongest at 10 months, and they are responsible for maintaining the head in an upright position with eye facing forward and level remain sure at there with the ear level. 10th is limb writing reflex. So here the level is cerebral cortex. Stimuli would be lateral displacement while standing. Response would be hops or a place limb to support the body. And receptor is muscle spring. So what happens over here? When the subject is observed while standing on an unstable surface, or if we give sudden shift to a one side, the positive response should be is that the limb extend and abduct in order to pull the body. So this is the positive reflex. But what happens in case of pediatric neurological condition like CP or a stroke patient? While trying to walk on an unstable surface fails to show a positive response. That is what is limb extension and abduction. And response should be fully matured by the month of 10 and 12 months and persist for a life. So, see, here is an example of a baby.
To perform this tip, have the child practice balancing while standing on an unstable surface. Once able to maintain balance, have the child reach while crossing midline
When
with
she
one hand.
tried to step, she
Perform this
did
tip,
a
have the child practice
extension
balancing while
and
standing on an unstable
abduction.
surface.
This is a positive one.
Once able to maintain balance, to perform this tip,
So, the absence of the limb righting reflex can lead to a significant challenges in maintenance of balance and a posture. Without this reflex, individual may experience difficulties such as standing, sitting, and even walking. And in adult, the lack of this reflex can result in a higher risk of fall injury and decline in a quality of. So this was an example of a positive response. Now we'll see what happens when it is not present.
When you're walking
So
with
this is
one
a
person,
patient
usually
of
walk
a
on
stroke.
the
He is
side
trying to
of the
walk,
patient.
but
We
there
can
is
do the
no
weight shifting
abduction
by
of the movement.
walking the same pace, and then we can with
So we
one
just
person.
read in adults, if it lack in stroke patient, there is an absence of this reflex. Then the 11th is optical writing reflex. Level is cerebral cortex, stimuli is visual cues, response is head, writing of the head, and receptor is retina and an eyes. So, example is when you hold a child in a vertical position in the air and you just gently tilts the body forward, backward, or sideways. The positive response should show that the head has to move to an opposite side of the tilt and eyes has to be stable. Then correlation is if this reflex fails to develop, it will cause difficulty in visual fixation during a motion. And the child will have problem in tracking object and maintaining balance. This response has to fully mature by 6 or 7 weeks and persist throughout the life. So what happens when optical writing, and we also read about the before we labyrinthine writing. So what happens if the both reflexes does not integrate? There is the failure of labyrinthine writing reflexes disable the body's innate mechanism for an automatic postural correlation. So in infant, it delays crucial motor milestone, difficulty in lifting the head while prone or rolling or sitting independently. What happens in children is that it hinders the coordination, balance, sensory integration, inability to harmonize vestibular, visual, and proprioceptive input, and increases clumsiness. Also, there will be a coordination deficit, difficulty in bilateral tasks, catch and throw skills, handwriting, and climbing. And in adults, as we saw, there will be increased fall of risk, limits the functional independence. Individual cannot automatically correct posture after a perturbation. So, when there is a damage to a brain, spinal cord, or a peripheral nerve, the body loses its ability to make this fine balance adjustment and causes neurological deficit. Whatever we had seen before, it was all a positive responses. So if there is a damage and when it is not there, we say it is an absence reflex and it may cause a neurological deficit. So what happened is that Sherrington and Magnus section the animal at various levels. As we saw, level that is spinal. Now he has taken into spinal, decorticate, decerebrate, and intake to study how different region of the brainstem and brain regulates muscle tone, posture, and automatic reflexes. So what is decorticate and decerebrate? Decorticate would be the lesions above the midbrain. The section would be below the midbrain and above the midbrain. So above the midbrain is called as decorticate and below the midbrain would be a decerebrate. So in 1898, he discovered decerebrate rigidity, an immediate state of extreme extensor hypotonia. And Magnus removed the cerebral cortex and he observed that a decorticate, that is upper limb, were curved and animal display near normal writing reflexes. So when there is severe brain injury, cuts off the communication between the upper brain and the midbrain stem, the body loses its voluntary motor control, causing these two pathological posture, that is decorticate and decerebrate rigidity posture. So decorticate and decerebrate reflexes are abnormal posture reflexes elicited by the CNS injury and reflects the site of severity of the brain damage. So either above the midbrain or the lower the mid. So what is the difference is that in decorticate posture, upper limbs is flexed at elbow, wrist and fingers. And in decerebrate, the posture is extended and pronated. In lower limb, in both there is extended of the lower limbs. Site of lesion is decorticate is above the red nucleus, that is the cerebral hemisphere, and for the decerebrate at or the below the red nucleus, that is midbrain or pons. And prognosis would be in decorticate it is relatively better, but in decerebrate it is poorer and more severe injury. Here is the picture for decorticate where you can see upper limbs are flexed and curved inward, that is flexion of elbow and adduction of the shoulder, but the lower limb into extension and plantar flexion. In decerebrate, the difference is upper limb is in flexion position, shoulder is adduction, elbow is extension, and wrist is in flexion. Now recent advances. There was a study made where development of the TLR, that is tonic neck reflex, with asymmetrical tonic neck reflex and symmetrical tonic reflex, which is also called as Tashun, for assessment of neurotypical children. So year-end publisher is 2025 and Applied Science. Participants were 242 neurotypical schoolgirls aged around 10 years. Assessment methods were done, all this, that is Tashon, TLR, ASTNR and STNR. Here each reflex were tested for 5 times and with the exercise 4 times a week given to schoolgirls. The key outcomes: retained primitive reflexes were detected in 84.7 to 95.7% of the children and decreased significantly with the age. This one is postural reflex and these two are primitive, both were tested. So take home message, that is Tashun is valid, reliable, quick test practical screening tool for assessing retained postural and primitive reflexes in neurotypical children, and it can be used by physiotherapists, teachers or a medical profession. Second study is that using postural reaction as a screening test to identify high risk infants for cerebral palsy. Okay. The year and author, it was done in 1998 by Penteliadis CP Etha. Study design was prospective cohort study. Participants were 204 high-risk infants. Assessment method was 7 postural reactions and reflexes which we saw were assessed repeatedly during the first year of life. So outcome measures were diagnosis of CP at the age of 3. The key outcomes were they found that abnormalities in 5 of the 7 postural reactions from the first month of life strongly predicted in a spastic CP. Then 5 or 6 abnormal reactions were also predicted in ethetoid CP. So take home message is that multiple absent or abnormal postural reaction are strongly indicator of the CP. These are the references, and thank you for your attention. Anyone has any questions?